If I'm driving by a group of kids in front of a high school, and we all know the groups of kids hanging out in front of high schools, most of them are smoking. So if I could go by and just get out of my car and just hand out a bunch of tickets, boy, would that send a message. I guess the question becomes not so much would it work or not, but what would you need to make it work? If you tried to enlist police in doing it, they say, so we're supposed to chase 12 or 13-year-olds around the block who are smoking? I don't think so. They're just not going to do it. They got other more important things to do. So there's the issue itself, would it really help? And then there's the effect on government's attention span of spending some time on that, working on it, thinking they've done something good, moving on, and not having done some of the other policy changes that we really need that are more important. That is sort of a demand side strategy. We got to get to the supply side strategy where we look at, for example, the number of retail establishments. There are thousands of retail establishments in every community that sell tobacco versus about 1,000 or so LCBO retailers and franchises for a product that has no safe level of use and kills half its long-term users when used as intended, tobacco. It's sold on every street corner. It makes no sense at all. If we're serious about cracking down on that supply situation, we've got to start limiting the number of retailers. We've got to have much more effective licensing requirements for retailers. You shouldn't be able to just be able to sell tobacco just by buying a business license, which is what you can do now. Somewhere between 60 and 80,000 kids, that's grade 7 to 12, in Ontario are smoking contraband. Well, they're smoking it and they're getting it because it's cheap. So you start going after the contraband, you make more cessation assistance possible, you reduce the number of smokers. Ultimately, we reduce our healthcare costs. So that's the longer term vision.